Have you ever stopped to realize that your seemingly innocent bedtime routine might be quietly putting your life at risk without you even being aware of it? It sounds startling, but according to the Centers for Disease Control and Prevention, over 70,000 older adults in the United States alone lose their lives during sleep every year. What's even more concerning is that many of these deaths aren't simply a natural consequence of aging. Instead, they are linked to subtle, preventable nighttime habits that most people never stop to question or reconsider. As you age, particularly after 60, your body undergoes significant yet often unnoticed changes. Your heart becomes more vulnerable. Your lungs grow more sensitive, and your brain responds more sharply to disturbances. Your sleep becomes lighter. Your muscles lose some strength. And what once seemed harmless before bedtime may now turn into a silent threat to your health and safety. Despite these critical changes, many older adults continue with their long-established nightly routines, unknowingly risking their well-being in the process. So, what exactly are these hidden dangers lurking within your nightly habits? Which common bedtime mistake causes more nighttime emergencies than any other? And most importantly, what immediate steps can you take to safeguard your sleep and improve your overall health? Starting tonight, let's explore 7 nighttime behaviors that have already contributed to tragic outcomes among seniors this year. Pay close attention, especially to habit number 2. It's shockingly deadly. But don't worry. I'll share practical and simple strategies to protect yourself. Starting with habit number 7, drinking excessive amounts of water right before bed. Hydration is crucial at any age, especially for older adults, as it supports vital organ functions, digestion, and joint flexibility. However, while maintaining hydration throughout the day is important, guzzling liquids, be it water juice or herbal tea, shortly before sleep can backfire. As we grow older, kidney function slows and the bladder's capacity diminishes. Combined with more urgent and frequent signals to urinate, drinking heavily near bedtime often leads to multiple nightly bathroom trips. Waking even once or twice might seem trivial, but for seniors, these interruptions greatly increase the risk of dangerous falls. Imagine being groggy, fumbling in the dark, with reduced balance and a sudden drop in blood pressure from standing too quickly. That short walk to the bathroom could result in a life-threatening accident. Falls remain the leading cause of hospital admissions for older adults, with many incidents occurring during nighttime bathroom visits. Beyond physical injury, these frequent awakenings fragment your sleep cycles, particularly the deep restorative phases, critical for brain repair and immune function. Chronic sleep disruption correlates with memory decline, heightened inflammation, and an elevated risk of dementia and Alzheimer's disease. Poor sleep also impairs immunity and worsens chronic illnesses such as diabetes and hypertension. There's an added cardiovascular strain to consuming large amounts of fluid before bed, forces your heart to work harder to manage the extra volume, which can trigger irregular rhythms or exacerbate heart conditions. The safest approach: hydrate steadily during the day, taper off liquids at least 2 hours before bedtime. And if you're thirsty, close to sleep, take only small sips. Avoid caffeine and diuretics like coffee or black tea in the evening to minimize bathroom trips. Ensure your path to the bathroom is well lit and clutter-free to prevent accidents. and rise slowly to stabilize your blood pressure. Habit number 6, eating late at night. A common comfort for many, that nighttime snack may seem harmless, but for seniors, it can trigger a cascade of health problems. As metabolism slows and digestion weakens with age, heavy or rich meals late in the evening keep your body active when it should be resting. This disrupts sleep and stresses your heart, liver, and digestive organs. Acid reflux is a frequent consequence. Lying down after a meal allows stomach acid to flow back into the esophagus, causing painful burning and inflammation. For older adults, this can lead to serious complications like esophageal damage or aspiration pneumonia if stomach contents enter the lungs during sleep. Studies reveal that eating within 3 hours of bedtime significantly raises the risk of reflux and its related nighttime disturbances, sugary or refined carbohydrates. In late snacks can spike blood sugar, particularly risky, as insulin sensitivity declines with age, increasing the chance of type 2 diabetes or worsening its control. Late meals can also keep blood pressure elevated throughout the night, heightening the risk of stroke or heart attack. Fatty or salty foods may even trigger dangerous irregular heart rhythms. The solution lies in timing and food choice. Aim to finish eating at least 3 hours before sleep. Opt for lighter, balanced meals with vegetables, lean protein, and whole grains, and avoid greasy or sugary foods. If hunger strikes late, try gentle options like a banana, plain yogurt, or a handful of unsalted nuts. Small changes here will improve your sleep quality and reduce cardiovascular strain. Habit number 5, sleeping in the wrong position. Your favorite sleeping pose could be silently harming your health. Lying flat on your back, though comfortable, may cause the tongue and throat tissues to obstruct your airway, worsening snoring and sleep apnea, a condition linked to heart disease, stroke, and brain damage. Back sleepers face up to 40% worse breathing obstruction and a 22% higher risk of cardiac events compared to side sleepers. Acid reflux symptoms can also worsen in this position. Moreover, recent research suggests that sleeping on your back impairs the brain's waste clearance by over 60%, potentially accelerating cognitive decline. Even sleeping on your right side has risks compressing major blood vessels and increasing heart failure risk in vulnerable individuals. Experts agree the best position is sleeping on your left side. It supports circulation, digestion, and brain detoxification while reducing reflux and stroke risk. Transitioning to this position may require supportive pillows to align your body and prevent rolling over. Slightly elevating your bed's head can further ease reflux symptoms. Adjusting your sleep posture can profoundly protect your heart, lungs, and brain health. Habit number 4, sleeping in a hot room. While warmth feels comforting, excessive bedroom heat can severely disrupt sleep quality, especially for older adults. The body's natural sleep cycle requires a drop in core temperature to enter deep restorative sleep. When the room is too warm, above 20 degrees Celsius, this cooling process is impaired, causing restlessness and reduced deep sleep by as much as 30%. Poor sleep from overheating increases inflammation, blood pressure, and vulnerability to heart disease, diabetes, and cognitive decline. Additionally, heat-induced sweating can cause dehydration, and thicker blood raising risks of clotting, stroke, and heart complications. Maintaining an ideal bedroom temperature between 15 degrees and 19 degrees. Using breathable bedding. Improving airflow with fans or open windows and layering blankets for easy adjustment can drastically improve sleep quality and health outcomes. Habit number 3, getting out of bed too quickly. Rising abruptly from lying down often causes dizziness, blurred vision, or fainting due to a sudden drop in blood pressure known as orthostatic hypotension. This condition is common in older adults and significantly raises the risk of falls fractures and hospitalization. Falls, especially at night or early morning, often lead to devastating injuries that reduce independence and quality of life. To prevent this, take time when waking, sit up slowly, move your feet, flex your ankles, breathe deeply, and sip water before standing. Ensure your path is well lit and free of tripping hazards. Wear non-slip footwear, and if possible, use stable furniture for support. Discuss medications affecting blood pressure with your doctor to optimize safety. This cautious approach can dramatically reduce fall risks. Habit number 2, ignoring, snoring, breathing pauses, or chronic insomnia. These seemingly benign symptoms may indicate obstructive sleep apnea, OSA, a condition where throat muscles collapse during sleep, blocking airflow repeatedly. OSA causes oxygen deprivation, strains the heart, and raises the risk of hypertension, stroke, and fatal heart attacks by up to 30 to 60% in seniors. Despite nearly 40% of older adults likely suffering from OSA, 80% remain undiagnosed, mistaking symptoms as normal aging. Untreated OSA also causes cognitive decline, memory loss, and brain tissue damage. Warning signs include loud snoring, gasping during sleep, frequent awakenings, daytime fatigue, and morning headaches. Chronic insomnia may also point to underlying health problems. If these signs resonate, consult a sleep specialist. Treatments like CPAP machines and lifestyle changes can reduce risks dramatically, improving heart and brain health. Habit number 1, taking certain medications before bed without proper guidance. Many seniors rely on nighttime medications for sleep, blood pressure, or pain, often unaware of hidden dangers. Sedatives like benzodiazepines can slow breathing and impair alertness, increasing falls and mortality risk. Muscle relaxants and some antidepressants disrupt deep sleep, worsening cognitive function. Painkillers like NSAIDs carry risks of organ stress and bleeding. Blood pressure meds taken at night may cause excessive drops, leading to dizziness or strokes. Drug interactions further complicate safety. Always consult healthcare providers before altering medications. Explore non-sedating alternatives and adopt natural sleep aids such as chamomile tea or relaxation exercises. Monitoring symptoms and medication effects helps maintain safety and sleep quality. In summary, these 7 overlooked nighttime habits can quietly undermine your health and longevity. By understanding and adjusting your hydration, meal timing, sleep position, room temperature, morning, movements, breathing, health and medication, routines, you take control of your nights and safeguard your future. Have you unknowingly followed any of these risky habits, or discovered effective strategies to improve your sleep. Share your experience. Your insight might just help others rest easier. Remember, even small, thoughtful changes to your nightly routine can lead to profound improvements in your well-being, energy, and peace of mind. Tonight is the perfect moment to begin